And here we go. All right. So we're going to talk about how paid leave applies to your businesses and tools for HR professionals. I know this is implementing paid leave, but I think everything that you will need, you'll find in this presentation, probably a little more detail than what you're looking for, but we'll have plenty of time for questions and answers. We'll just go over a little bit, and I appreciate your patience. So it's a little bit about me. I came to the Paid Leave Authority a little over a year ago. I used to run an agency that supported people with intellectual disabilities, and now I am working with a fantastic team of people. Today, we'll talk about the program itself, what is family and medical leave as compared to what is Connecticut paid leave, implementing the Paid Leave Act and coordinating the benefits that come when employers provide PTO and other types of benefits. Then we'll talk about family and medical leave, which really is not the purview of the Paid Leave Authority. It's really the the responsibility of the Department of Labor to govern all things FMLA, but we know these things are so closely tied that we do spend some time talking about it. We'll show you where you can find some additional resources, and then we'll have time for questions and answers. So just starting out with an explanation as to what the Paid Leave Authority is, we are the agency that is responsible for administering the paid leave program, and that includes really 5 primary components: outreach and engagement, developing the policies and procedures that are needed to run the program. We're also responsible for establishing the trust fund contribution rate, and by statute that cannot exceed more than 0.5%. And we receive those contributions in a trust fund that is managed by the Office of the Treasurer. We also audit and approve all the private plans for those employers that wish to offer their own plan in lieu of participation in the private plan, in the public plan, I should say. And then we administer the claims for paid leave benefits, which will be starting in about 30 days. Here are some of the key dates that you should be aware of. We started registering employers for the program last November, so almost a year ago. And deductions from employee wages started in January, also close to a year ago. It's hard to believe that. Starting in February, those employers that wanted the option of offering their private plan started to submit their applications, and those were approved as they came in. Then for those employers who are participating in the public plan, they had to withhold and submit contributions to the plan quarterly at the 30 days after the end of the quarter with a 30-day grace period. Starting in December, workers will be able to file an application for paid leave benefits, and benefits will start being payable effective January 1 of 2022. A bit about who is covered by the plan. The plan covers employers that have 1 or more employees working in Connecticut, and that's by statute. And that does include nonprofit employers and private sector employers that have unionized workforces. If you are a sole proprietor or a self-employed individual, you may opt into the program, but if you do so, you do have to remain in for 3 years. If you are a sole proprietor and you have employees, you may opt in, but your employees are required by law to participate in the program. Those employers and workers and employers and workers that are not covered include those that work for the federal government. And the state of Connecticut, with some exceptions that I'll go over, are known as covered public employees. The same is true for municipalities or local or regional boards of education, unless they too have what are known as covered public employees. Non-public elementary or secondary schools are exempt from family and medical leave and the Connecticut paid leave program. There are some other entities that are also exempt as a result of other laws, usually federal, and those are railroad workers, as an example. Folks that live in Connecticut but may work for other states. We have quite a few people that live in the state but work for universities, as an example, state universities for other states. Employees of sovereign nations, and that does include the tribal nations that, for Mohegan and Foxwoods, as we commonly know both of those casinos and those tribal nations. Employees who engage in interstate commerce, but they may live in another state and they don't pay taxes here. and also the spouses of active military members who are continuing to pay taxes in the place they consider their home state instead of where they're currently deployed. Covered public employee, as I mentioned earlier, can participate in the program under two circumstances. One, if they're a non-unionized employee of the state of Connecticut, they are required to participate like every other worker in the state. Those that are unionized, they collectively bargain to participate in the paid leave program. If a person is an employee of a municipality, or they work for a local or regional board of education, and the unionized employees in either of those workforces choose to collectively bargain to be included in paid leave, then everyone who works there, whether they're in the union or not, is a part of the paid leave program. And as you can see at the bottom of this screen, there is an extensive definition of municipality, which can include a town or a city. As I think about it, it can also include a regional council of governments or a flood commission. I mentioned earlier that the contributions have started to come in starting in January, and here's a chart that essentially explains the flow of how that works. So the contributions are always post-tax, and they're based on the FICA wages that employees receive. The contributions are capped at the Social Security contribution limit of about $143,000. And what happens is once those contributions are made, they're mostly withheld by employers on behalf of employees, and they are remitted to the Paid Leave Authority. We receive those and we validate those against data that we receive from the Department of Labor and the Department of Revenue Services to make sure that the amount that's being contributed is equal to the payroll numbers that are being submitted to at least those two other state agencies. The contributions are deposited into the Paid Leave Trust Fund that is managed by the Office of the Treasurer, and it's from that trust fund that the benefits are funded, that are payable starting in January. So what exactly are we collecting and paying for, and what's the difference between FMLA and Connecticut paid leave? Starting with FMLA, some of you may be very familiar with this, but I just want to review it so that we can all be on the same level playing field. It does stand for the Family and Medical Leave Act. There is both a federal and state corollary to that law. Both of them allow for job protected time away from work for specific family and medical reasons. But as we sit here today, if you were to take FMLA, either state or federal, it is unpaid unless you had an opportunity to accrue enough time or your employer has a generous paid leave policy, and some in fact do. Now, some employers provide that, and others require or permit their employees to use their accruals, sick leave, whatever else they may have, while they're out on FMLA. But for Connecticut, all of this will change significantly starting next year. And here's a chart that summarizes what that might look like, or as a matter of fact, what it will look like. As I said, as you see here today, the current Connecticut FMLA applies to employers with 75 or more employees. And for a person to have been eligible to take advantage of FMLA, they had to work for that one particular employer for 12 months, doesn't have to be consecutive, and at least 1,000 hours right before the time that they're going to apply for leave. Once they do so, then they enjoy what's known as job protection, which is the ability to get their job, same pay, same hours when they return from FMLA. They were getting 16 weeks of leave in a 24-month period and 26 weeks of leave if they were taking military caregiver leave. And the employer could require the employee to use all of their accrued time to cover all the time that they're away. Starting next year, this will be very different. The Family and Medical Leave Act, as well as the paid leave program, will apply to all employers with one or more employees. And there will be no hours worked requirement in order to qualify for the leave, and job protection, as I just described it, will attach after 3 months rather than 12. The person can then take up to 12 months leave in a 12-week period and 26 weeks of leave, only 12 being paid, however, for military caregiver leave. But there could be an additional 2 weeks of leave available if a person is experiencing incapacitation during their pregnancy as defined by their healthcare provider. And one of the most important changes to be aware of is that while now an employer can require an employee to use all of their time off to cover the time that they're away for FMLA, that will no longer be the case starting next year. They must allow an employee to keep up to 2 weeks of accrued PTO. The thought process behind this particular provision is that people had testified when the bill was being considered that they were forced to use all of their PTO when they were taking time for FMLA. And so then when a significant life event happened later in the year or later within their cycle of getting PTO, they could not be a part of that. And we're talking weddings, graduations, dream vacations, all kinds of things. So the idea is that people will no longer be required to exhaust all of their time and have time available for those types of activities. So let's contrast that to what is paid leave. Paid leave is different, and we often refer to it in the context of the statute itself, the Paid Leave Act, the program, the paid leave program, and the agency that administers the program that is established by the Act. So sometimes you'll hear us refer to paid leave, and it refers to all of these things depending on the context. It is a Connecticut law only that offers a source of income replacement benefits. It's really important to note here, it does not provide for job protected leave. So a person could conceivably qualify for paid leave, not be at their job for 3 months, and not have any job protected leave. And I'll talk a bit more about that in a moment. So we also refer to it as PFML or paid family and medical leave. Here are the reasons why you can take FMLA, and they're the same reasons you can seek income replacement for paid leave. You can take it to get treatment or to recover from your own serious health condition, and that can include pregnancy or becoming an organ or bone marrow donor. You can take it to take care of a family member or to bond with a newborn or a child that's placed with your family as in foster or adoption, and it's all known as bonding leave. You can avail yourself of leave to care for a family member who is injured during active duty, and that applies to the caregiver, not necessarily the person who was injured during active duty. And the same is true for a person who is supporting someone who's been called to overseas active duty, known as qualifying exigency leave. And what is unique to Connecticut, however, is the ability to take up to 12 days off to address specific issues associated with family violence, also known as family violence leave. So our state has had a Family Violence Leave Act for some time now, but those 12 days had to be taken without pay. And so now if a person has to take that leave, they can come to the Paid Leave Authority and be covered for that. What exactly is caregiver leave and who does it cover? So under the Connecticut law, starting next year, an employee can be a caregiver and take leave and seek paid leave benefits to care for all of the categories you see listed here. This is significantly different than the way FMLA works now, especially in our state. It was limited to being able to take it for a spouse or a parent or a child who is 18, under 18, or over 18 if they had a disability. And these other or in-laws, and these other categories were not covered. But now there's a much more expansive definition of family that would qualify a person to take caregiver leave, and that also includes related by affinity, and this is something very new. So what exactly does that mean? It means that a person has a significant personal bond with someone that's like family, listed in the statute, regardless of whether they have a biological or legal relationship. So let's say, for example, you are the godparent to your best friend's children, and you've known them since they were very, very little. You consider them your own children. You've been to everything from their christening to their high school graduation and all the steps throughout. And now they are unfortunately seriously ill, and you're part of that circle of caring. If in fact you could demonstrate, for example, that that person is like a child to you, then you may be able to qualify to take leave to take your shift and your part in caring for them. More traditionally, we see this with people who are in long-term relationships, but not necessarily married. So they may have raised children together, own property, be beneficiaries in one another's insurance policies. but they are not legally married. Under this, with the appropriate proof, a person could show that they're related by affinity and be able to take leave to care for that other individual in their lives that they consider family. A bit about what the eligibility requirements are. As I mentioned before, FMLA has a state and federal corollary. So the federal piece isn't changing at all. And that still requires a person to work for 12 months and at 1,250 hours. So it's 250 hours more than what even the state was requiring. And now, starting next year, the job protected leave, as we mentioned earlier, attaches at 3 months, and there's no hours worked requirement to qualify. But to get your income replacement, there are some qualifications. You do have to earn at least $2,325 in the highest earning quarter of what we call the base period. And that is the 5 quarters, completed quarters before you apply for leave. Then you also have to have a reason that's covered under the statute. You have to be employed or working in the state or no more than 12 weeks out from having been employed and working in the state. Obviously, sole proprietors and self-employed individuals who are contributing to the fund and they've opted to participate, they too can do so. So here's where I will talk about what I mentioned before. How is it that a person can qualify for paid leave and not have job protection? Here's why. You could have worked anywhere in that base period, as is described here, which is the last 5 completed quarters, and earned that $2,325. You could be currently employed at your current employer, and you could have a reason for leave. That is part of one of the reasons in the statute. Now, you show up for work day in week 3 in your current employer, and you say, I now have to have surgery and I need to go out, and I'm going to be applying for paid leave benefits, and I want to let you know that I'll be out. Now, you as the employer, because they've only been there 3 weeks, can easily say, you don't have job protection. We're not going to hold your job for you, but you should go ahead and apply for your paid leave benefit. But just know that you will have to reapply, or you'll have some other consequences associated with leaving before you have job protection because we need you here, whatever the story may be. And that's a very, very possible and plausible scenario that employers should be aware of. The person could come to the paid leave authority, and if they meet all the criteria, we will approve them because these are the criteria for income replacement. We'll also let them know you might not have job protection, so you want to figure that out with your employer because you don't want to be without a job after you've come back from leave. We talked about this earlier, but here's a summary of the entitlements, meaning the lengths of leave that a person can get under the 3 types of FMLA and income replacement benefits that exist. Federal remains the same. We talked about that, 12 weeks in a 12-month period, 26 weeks for military caregiver leave. That hasn't changed. Job protected leave, 12 weeks in a 12-month period, 26 weeks for caregivers, 12 days for family violence, additional 2 weeks for incapacitation during pregnancy. And those same job protected reasons are also the same lengths of time that are available for income replacement benefits under the paid leave program. So to summarize all of this, when a person takes FMLA, they do have a number of other laws that might apply to what is known as job protected leave, meaning the types of laws that protect their ability to return to their job, or if their job no longer exists, a substantially similar job. It has to be virtually identical in pay, rank, hours, all of those things, even if their specific job doesn't exist when they return. That includes the federal FMLA, Connecticut FMLA, workers' comp, the Americans with Disabilities Act, the Pregnancy Disability Act, and a lot of employers do not know this, but the Connecticut Fair Employment Practice Act may also require some form of job protection, and it does apply to places that have 3 or more employees. I know a lot of small employers are not aware of that. There is only one addition now to income replacement for leave, and that would be the Connecticut Paid Leave Act. Workers' compensation continues to be a form of income replacement, but a person is ineligible to receive both workers' compensation and paid leave benefits at the same time. They are also by statute ineligible to receive unemployment insurance, unemployment payments, and paid leave at the same time. All right, so let's talk a bit about implementing the paid leave law itself. who has to do what. So we call this the responsibilities of the paid leave program. First, we'll start talking about contributions, which I said started in January. So the workers are responsible for contributing 0.5% of their FICA wages up to the Social Security limit. The employers have to create an account with Connecticut Paid Leave, make sure those deductions happen, and remit them to the authority. At the authority, we receive and reconcile those contributions, and we're also responsible for processing any over or underpayments and imposing penalties for noncompliance. In this calendar year, we have not imposed penalties for noncompliance because there's been a pandemic and things have been really difficult, and we really just want people to participate in the program, and we didn't want to make it difficult. But now 122,000 employers have registered and are participating. So penalties may start next year for those non-compliant employers, once we've had an opportunity to speak with them and get them on board. The Department of Labor is responsible for determining whether an employer may have an additional opportunity to withhold that 0.5% beyond, let me just not say beyond, but to go back in time and collect that money retroactively. And it's only the Department of Labor that can make that determination based on their general authority under the wage and hour rules. All right, now, what about claims? Here's how it all shakes out when people are, as we take a look at the responsibility landscape for claims. Now, the workers are responsible for submitting their applications, and they must do so to AFLAC in a timely manner. If they know they need to go out on leave, 30-day notice, I'll go through this in more detail in a bit. They do have to create an account if they apply online and provide supporting documentation. They have to let us know if they're working other jobs or they have other sources of income. And they have to let employers know that they are making a claim at the Paid Leave Authority. Employers will be asked to do a few things as well. We will be asking you to verify employment and to validate absences and any other source of income that you might know that employers have. You'll also need to let your workers know about your PTO policies, including whether or not you have any short-term disability policies that affect their ability to collect paid leave benefits. And this is also an ask by the Department of Labor to make sure, because this is new for so many employers, that you refrain from discriminating or retaliating against a worker for taking their paid leave benefit or filing a claim. At the Paid Leave Authority, we work with our partner AFLAC to do a few things. They will work with us to determine eligibility, collect the documentation, calculate and pay the benefits, and monitor your claim. They will also assess any request for reconsideration if a person receives an adverse decision regarding their claim. They will investigate potential fraud and impose penalties as appropriate, and that will be done through the Paid Leave Authority, not directly through AFLAC. The Department of Labor is responsible for hearing any appeals that are related to denials of claims and any penalties that we at the Paid Leave Authority impose. Okay, so let's walk through a little bit more detail about how the claims process will work. They can do this in several ways. So a person can call AFLAC, they can fax it, they can mail it, or they can go to the ctpaidleave.org, create an account that will secure their information, and then go on to submit their claim. Once they've done that, no matter how they do it, they're going to need to supply the same information, which will include their reason and the length of time they'll be away, the type, and whether or not they'll have any other sources of income, whether that's employer paid benefit or anything else. Now, AFLAC will work with us to determine a worker's eligibility, whether or not they're covered, if they're working for an employer who actually has its own private plan, therefore they're not eligible to participate in the public plan, and they will notify the person of those decisions. Now, if they determine that a claim is approved, they'll review the documentation, they'll let them know if anything is missing. If a claim is denied, then a worker can then ask for a right for reconsideration, a right to have the decision reconsidered. Let's assume what we call the happy path, that everything is approved. We calculate the benefit, taking into consideration whether or not the employer, when we say offsets, we mean, does the employer offer any time that would be covered by your leave? So if you, for instance, have an employer that requires you, let's say you have 5 weeks of PTO, and your employer says you need to use that time to cover all or part of your leave, knowing they get to keep 2, they would cover the 3 weeks, let's say of an 8-week leave, and then they come to the Pay Leave Authority and get the rest. AFLAC issues the benefit, and benefits are paid each Tuesday, 2 weeks in arrears. And as an example, if you are eligible for benefits that would start on the week of January 2nd to January 8th, your first payment would be issued on January 18th. And this is not uncommon. Virtually every state that has paid leave benefits are issuing payments in arrears. Excuse me. Now, the workers also have a responsibility for letting us know if there are any changes to their start or end date, to their employment status. And if they're taking intermittent leave, we will be asking them to report in more frequently than they would if they were taking block leave, because sometimes intermittent leave can change week to week, month to month. So we want to make sure that we have the most up-to-date information about that. How much does a person get? Well, it's statutorily defined. If they are making less than or equal to the minimum wage multiplied by 40, this is the statute, then a person will get 95% of their wages. And we can see now that the minimum wage is $13 an hour. So you can see 40 times 13 is 520. And then on the next slide, I have actually an example of how this works. If a person is making more than the minimum wage multiplied times 40, they still get that 95% of 40 times the minimum wage, and then they get the 60% of the difference between what they make and what that number is. But the maximum anyone can get is 60 times the minimum wage, which right now is $780. Couple of examples. Here's a person that earns the minimum wage, $13 an hour. So their base weekly earnings are $520. 95% of that is $494. This other worker earns above minimum wage by about 50 cents. So they still start out with their base weekly wage of $540. Those are their base weekly earnings. And then you can see the formula is 95% of that plus 60% of the difference of what they make and what the 95% is, which is $12, and they get $506 a week. All right, so what happens if an employer has some kind of employer-provided PTO and a person gets the paid leave benefit? Here is the chart. I like charts. So let's start on the left side. The employer can permit or require, just as a reminder, the employee to use their PTO, but starting next year, they have to allow them to keep up to 2 weeks of leave or PTO. If the worker has no PTO, then they will receive the full amount of their benefit for the full amount of time from the Paid Leave Authority. If they have enough to cover the entire leave, then that is paid to their employer. And some employers are doing this to avoid something that's called stacking, which is that you take all of your PTO and you use that first, and then you still have federal leave, and then you still have Connecticut paid leave, and you can be out for an extended period of time. And some employers are not encouraging that. So they do have paid leave policies that require the employee to use their time. And if in fact they do that in whole or in part, then the worker will not receive a paid leave benefit. Now, here's a question we often get. Well, why are they paying into it if they can't use it? Because they often don't work for that same employer forever. Then they'll move to another employer who will have a different policy, and they will want to avail themselves of the paid leave program, and they'll be able to do so. If they have PTO that covers part of their leave, then they'll get part of that time that's paid. If you remember the example I spoke of earlier, where a person has 5 weeks of leave, they're going to be out 8 weeks, so use 3 of those weeks to cover the first part, and we will pay for the rest. And if the PTO pays less than their regular wage, then we pay our part according to the law, and the employers can coordinate whatever other benefits there might be to make up the difference, but employees should get no more than 100% of their regular pay by statute. So what do your workers need to know? A few things. They'll need to know whether you require them or permit them to use their PTO while they're out on leave. And if you have specific rules about how they can use their sick time, how they can use their PTO, whether or not you offer a short-term disability policy, and if so, do the terms and conditions of that policy require them to use their state benefits first, or does it pay part of it and then they come to the Paid Leave Authority for the rest? They'll need to know these things from you as they're applying for their paid leave benefit. Now, I mentioned earlier that family and medical leave is the purview of the Department of Labor, but because these things are so closely aligned, we do want to go over this a little bit. Now, family and medical leave can be taken for the same reasons that paid leave can be taken, and workers and employers essentially have the same responsibilities as they do under Connecticut paid leave. They have to let Workers have to let the employer know that they need to take time away. They have to submit an application. They have to provide that employer with the application if they comply with the attendance policies. Employers need to establish a leave policy if you don't have one already, especially about how PTO can be used. There is a family and medical leave poster that's available, and I think the DOL is updating it now, so that that can be placed in conspicuous places throughout your workplace, or if you're not back in your workplaces, it'll be distributed electronically to let people know what their rights and responsibilities are under FMLA. You need to have the ability to process the leave request and monitor how it's being used so the person does not exceed their 12 weeks or that they're not using it in a way that's inconsistent with the documentation that they provided. You will also manage their return to work. So if they're going to be out for 6 weeks and about week 4, you probably want to give them a call saying, how's it going? So coming back in 6 weeks, let's try to transition it back in, that kind of thing. And again, refraining from discrimination or retaliation for using FMLA. We at the Paid Leave Authority do not have any official responsibility regarding FMLA, but we do like to let employers know that there's such a close correlation between these two things, and it's important for you to know about it. This is all under the purview of the DOL. They will promulgate the regulations. They will provide guidance to employers about how to manage their workforces. And they're the ones that will investigate complaints about retaliation or discrimination or denials of FMLA. FMLA is a job protected leave. So here's just a few steps about how you might go about doing that. First, the worker has to let the employer know that they're taking time off from work, and they don't have to say, I need FMLA. If they come in and say, I need to be out for 5 weeks because I'm having hip surgery, that's enough to trigger an FMLA notice. They need to let you know 30 days in advance if they know, or as soon as practicable if it turns out to be an emergency. The employer first then determines whether or not the person has some degree of eligibility. So if they come in and they say, I'm having surgery on my hip, or I have an old college injury and I'm going to get my knee done, or whatever it happens to be, that is probably a serious health condition that's covered under FMLA. And excuse me, then they'll let the worker know, all right, it sounds like it's FMLA, but you need to bring me some more documentation. You give them a notice that says, here it is, and here's a list of the stuff that you need to bring me. It's not the same thing as saying you have your leave approved, and then you can see that note there. Then the worker has 15 days to bring you back whatever's on that list, the medical certification, their adoption documents. If they have trouble, you can give them an additional 15 days. When they bring everything back to you, then you as the employer have 5 days to decide whether or not they qualify for FMLA. And once you make that decision, and let's say you approve it, then you have to let them know you need to use your PTO. You have to follow our policy. Here's how you have to report in. This is what you need to do. And you need to let us know when you're due back. And you have to track their leave. So finally, as I mentioned before, for job protected leave, the person comes back to the job that they had before they went out on leave. Same job, same terms, same conditions. You cannot insist that they're 100% fit for duty or they're totally recovered. And in the slides before, I mentioned there's some other laws that may also apply to a person returning from family and medical leave that may require you as an employer to make some reasonable accommodations to allow them to return to work. And that is a webinar for another time, and we're happy to get an employment lawyer to come in and speak with you about that. But for now, this is what we're going to cover. As you might have imagined, it's a bit complicated, and there are all kinds of complicating factors when you're managing FMLA. You can have different call-in policies. If you're a unionized environment and you have multiple bargaining units, each one of those bargaining units might have a different attendance and call-in policy. This is not a favorite thing of supervisors. They don't always necessarily like to track this. So you may have some challenges with supervisors who may be reluctant to be a part of the process. Sometimes you don't always get all the information that you need from your employees, and that can be challenging too. And workers who are taking intermittent leave, which means a few hours a day or a week, that might or might not be scheduled depending on the chronicity of their condition or that of a person that they're caring for. Migraines, asthma, these are the types of reasons people often take intermittent FMLA. Those are tough to manage. But a person does have to use whatever call-in or work reporting, terms and conditions of employment and policies that you have in place. People may have fluctuating work weeks, and there could be interaction between Connecticut FMLA, federal FMLA, other laws that we talked about before. One of the things you should really know about is workers often don't want to have FMLA designated as FMLA because they have the 12 weeks and they don't want to use any of those weeks, essentially saving it for a time when they may either know and can anticipate, or they might know that they have a serious health condition that might require them to use it. But you as an employer cannot do that. So they may come in and say, all right, I'm going to go have the surgery on my shoulder. I'm going to need 5 weeks to recover. But I just really want to use my sick bank. I don't want you to designate it as FMLA. That might not be possible because it could be a serious health condition that is covered under FMLA, and you as an employer have an obligation to designate that time off. And here's why you want to do that. Let's say in week 3, somebody comes in and is doing that person's job, and you might like that person's performance better than the other one. Both of you are now protected by FMLA because FMLA provides job protection. You've given that person leave under FMLA, they have job protection, and that is the best way that you can manage it. So don't fall into the trap of not wanting to designate things as FMLA. It is not a good practice. I've covered a lot of things. And I appreciate your patience with all of our technological challenges. We did start a bit late, but I promised you I'd get through everything. There are places where you can find additional resources, and they are on our website, ctpaidleave.org. There we have 3 different versions of what the basics are of paid leave that you can find under this expanded employee rights poster, under the employee rack card, which is really just a shortened version of the poster, and then a fact sheet that's more like a question and answer format, because we know people take information in different ways. You'll see now that we have an updated employer toolkit for 2021. There's also, that's not on the screen, is an HR resource toolkit that you'll also find on the website that has everything I just talked about: FMLA, CTPL, the documentation that you need, the employer verifications form for AFLEC, sample letter you can use, everything's in there. And if you haven't started withholding contributions, there is an employee paycheck mailer that you can include, that you see here, that says this is why the money is coming out of your check. I'm really hoping that does not apply to anyone here, but if it does, that's what's available to you. And we are here to help. We do not have a call center because we have one source of revenue, and that is a small percentage of the money that is collected through the trust fund. And call centers can cost up to $5 to $6 million a year, and that is not how we want to use benefit resources. So instead, we have a Contact Us portal, which you can reach through our website, ctpaidleave.org, and a small team of people will get back to you within 24 to 48 hours. We also have a lot of frequently asked questions and videos that may help to answer some questions that you might have. And again, here's our website, ctpaidleave.org, and I want to thank you for your time. All right, so Amber, thank you for sending me the deck, and we were able to move forward, and let's see what questions we might have.
Yes, and your Wi-Fi has been hanging in there with us too.
I'm so glad.
That's a plus.
I think I've got every hotspot I could possibly find attached to it. So it's probably like 6 different things it's attached to right now. I didn't want to take any chances. So.
Oh, good. Well, we do have quite a few questions, a lot of them surrounding the short-term disability, which I know we've been getting a lot about.
Yeah,
so I'm going to start up at the top with Michelle Raffles and kind of work our way down, okay?
Okay, sounds good.
Can you talk about how short-term disability can make an employee not eligible? For example, we offer all employees at a minimum 4 weeks, 100% paid short-term disability.
Right. All right. So it all depends on the terms and conditions of your policy and your condition. So if this is why this is a tough question to answer sometimes. So I'm going to assume for the sake of this particular example, your short-term disability policy offers 100% for the 4 weeks, but it requires the person to use that policy first and then then access any other benefit they may have. If that's the case, then the person isn't necessarily ineligible if their leave exceeds that 4-week time period. So we're going to assume for the sake of argument that they're taking 8 weeks of leave. The first 4 weeks would be covered by the short-term disability policy. The remaining 4 weeks would then be covered by the paid leave authority. Because a person can make a maximum of $780 in benefits a week in wage replacement, if then the person says, well, that's not enough, I need to get to 100% wage replacement, and they have PTO or other kinds of benefits that you would offer them that could bring them up to 100%, that is something that they would coordinate with you as the employer. If it's flipped and it's the other way around, and your policy says, we are the payer of last resort, so they'll go to the paid leave first, and then they'll come to us, then we would pay the first 4 weeks if the person is taking an 8-week leave, and then their STD would pay the remaining 4 weeks. So that's how it would work, but it all depends on what your policy says. So those are just a couple of examples of how it might work.
Okay, great. Thank you. Next is from Linda Marquez. I understand that starting in 2022, employees can reserve up to 2 weeks of PTO and will not be required to exhaust their annual allotments. My question is, can employees draw from the employer parental leave benefits and collect from Connecticut paid leave at the same time?
So does that mean that the employer offers a parental leave benefit? Is that what I'm understanding?
That's how I'm reading it, yes. So that the employer's offering one.
You know what, Linda? I may ask you to come off mute if Amber can make that happen so I can better understand your question. I really want to hear what you're asking.
Find her. Here we go.
There we go.
Hi, Linda.
Hi, Linda. Thanks. I really wanted to hear from you questions. So if you could pose it again for me, that would be great.
Okay. So we offer parental leave where we give the primary caregiver 6 weeks of pay at 100%. And we usually require that they utilize their PTO banks in the process to make them complete. So I have someone that is expecting to give birth in January, but is being put on medical leave in 2021. Can I have them exhaust their PTO now? And next year, once January 1st comes by and she has the baby, will we be paying her our parental leave at 100%, which means that she's not getting the CTPL, or is she going to get that at some point in time?
Oh, that's an excellent question. An interesting scenario. So this year, the law is the law. So the law doesn't change until January. So yes, theoretically this year you could have her exhaust all of her PTO because the law hasn't yet changed. Starting next year, however, you'll have to permit her to keep the 2 weeks, and she can still use, let's say that she has another allotment of the parental leave, I'm just assuming that, she can still use that, but remember she's eligible for up to 12 weeks of paid family and medical leave and 12 weeks of FMLA, because they basically, so she has the 12 weeks of FMLA, and then she can come to the paid leave authority to be paid for all a part of that. If she's using all 6 weeks, let's say she's taking 8 weeks, so if she's using 6 weeks of your paid parental leave, then we would pay the remaining 2 weeks. But obviously we wouldn't be paying 100%. We'd only pay up to let's say she has the maximum of the 780. So that's what she would get, right? So that's essentially how it would work. And you can, as an employer, either permit or require a person to use their PTO, withholding that 2 weeks, or any other kind of policy that you have that covers that time, and then have the person come to the paid leave authority for the remainder of that. That's how the statute reads.
Okay, so the second part of my question is, the 12 weeks, if she's technically going on leave in 2021 for 6 weeks or so, then she only has another 6 weeks? Or does the CTPL start on January 1st and we need to count 12 weeks from then?
No, that's an excellent question. It is we at the Paid Leave Authority are using a rolling back period. So if we would start counting back a year from the time that she applies for the leave. So if she's already used 6 weeks, it doesn't matter if it was in 2021, we're going to count back. So she would only have then the 6 weeks of leave remaining.
Great, thank you. That's what I wanted clarification on.
Okay.
Thank you so much.
You're welcome.
Andrea, that would work the same with FMLA as well, right? The 6
Right. Yeah. So I think that I think the simplest way to think about it is the person comes to you for any type of leave that would be covered by FMLA. And we used to teach this early on. And then you want to think about income replacement. And there might be parental leave, like it's offered at Linda's organization. A person could have their own individual disability policy. A lot of people have it through AFLAC, as an example. There could be short-term disability. There could be all kinds of ways that a person can get income replacement while they're out on FMLA. And Connecticut paid leave is one of those ways that a person can have income replacement. So that's why that coordination is really important. So a person comes in to Linda's organization, they're having this discussion. I'm going out to have my baby. It's covered by FMLA. Okay, how am I going to get paid while I'm out? What are my options? I can use my parental leave and I can cover the rest of it by going over to the Paid Leave Authority. So it's really important not to think of it bifurcated, because it's actually, how do you find a way to get a person paid while they're out on FMLA? That's really the way you want to frame it.
Yeah, I'm glad that you made that point, because that actually rolls right into our next question, which is, can someone use STD to cover the remainder of their Connecticut paid leave paycheck?
They can, if their policy permits that, and that's part of their employer policy, they certainly can do that. Because what we will do is simply pay the benefit based on their base period earnings and the statute. So if a person wants to, if an employer wants to, the typical term is top up, that's what's used in the paid leave parlance, then they can certainly do that in coordination with their employer.
Okay, great. If an employer pays holidays, how is that reported to Connecticut paid leave and counted towards their leave max?
Wow. I have never gotten this question, and this is great.
I know, this is like brand new. This is a two-part question, by the way.
Okay, so you can tell I'm just like such an employment paid leave nerd, because this actually is exciting to me. This is a great question. All right, if a person, what we will be asking for is what the person's schedule is. So that's part of what will be in that employment verification form. If a person is normally paid for that holiday, and they are on leave, and they would not be paid for that holiday if they were on leave based on your policy, then they wouldn't be paid for that leave under the paid leave program. If it's your practice to pay a person who's out on leave for their holiday, to pay a person for a holiday, to say it different, whether they're on leave or not, then that is something you would report to us, and the person would be paid. So essentially what we'll be doing is following whatever your policy is. Most people, if they're not paid for the holiday, then we're not going to pay them. And if they are, then they are. It all depends on what their work schedule is. For folks that work in hospitals, right, for first responders, they work all the time. And they often are working on holidays because, we count on them and we appreciate them. So their schedule will look different than, let's say, someone whose schedule is more predictable, maybe someone who works in one of our larger corporations where they might be closed for a holiday, and people are either paid if they've accrued the time. If it's floating holiday, we'll be asking those questions so we'll know for sure.
Great, thank you, Andrea. And we're down to one more question.
Okay.
Will the benefit, are we anticipating the benefit amount to increase in July when the minimum wage increases?
Yes, and that's already built into all of the actuarial analyses for the fund. Now, again, no one's ever asked that question before either. you guys are great, and especially for 5 o'clock on a Monday. These questions
I know,
are
they're on point.
These questions are really terrific. I'm just so happy. Thank you. Well worth all the drama of getting online with my million hot spots. I'm so glad to be able to field these questions. So the answer is, in fact, yes. The benefit rate will go up based on the minimum wage. Our numbers already account for that.
Fantastic. Well, that concludes our questions, Andrea. Thank you so much to everyone who joined us. We really appreciate it. I'm going to drop a link in the chat real quick to our contact center. So if you have any more questions going forward, please do feel free to reach out to our contact team and they will follow up with you. And that's it for me. Thank you so much, Andrea.
Amber, hang on. Did we ask this question? Does the CTPL have employer notice requirements at the time of the event? It was in the chat. I know FMLA.
Oh, no, I did not see anything in the chat.
Yeah, so there's one question. Does the CTPL have an employer notice requirement at the time of the event? I know FMLA has a notice. So the answer is it will come July of 2022. I do not have an answer for you as to why it's in place now, but the statute said you have to start informing people in July of 2022. But if you download that employee rights poster that we have on the employer section, just send that to people, put it up, that'll be fine, and we will modify it as we get closer to July. So I hope that answers your question. Okay, now I think we've answered all the questions. Thank you again for your time. I truly, truly appreciate it.
All right, thank you, Andrea. Have a good night. Bye-bye.
All right, thanks. Bye.